going to click the record button. In case anything happens to our conversation, I want to make sure that we have it all. So every couple weeks we come together and we talk about the initiatives and what BCHIP is doing. You got something big to say about your advocacy work in Harrisburg? I'm going to turn it over to you, Kim.
We do. So I'm really excited. BCHIP is a member of the Bucksmont Collaborative. The Bucksmont Collaborative is another nonprofit organization, and they are dedicated to fostering information and resources and support for health and human service agencies across Bucks and Montgomery County. And so they're a really good organization. They provide training for us as nonprofits. They provide additional resources for us. They do have a lot of support in providing resources around DEI. But one of the programs that I'm really committed to is they have a community advocacy network. They call it the CAN. And many nonprofits want to be involved in advocacy, but most nonprofits don't have training, they don't have the resources, they don't have somebody designated to that work. And so what the CAN has been able to do of the Bucksmont Collaborative is bring those folks together to talk about what is shared language and shared priorities that we can all agree on to talk to our legislators about.
Hey.
So they convened about a year ago where they brought a lot of the folks to the table and we talked about what the priorities were. And really there were two overlying messages, and one was around housing because we know that homelessness, and then the second piece of that being affordable housing in Bucks and Montgomery counties is really challenging. And then the other piece is mental health. So there's two giant priorities that everyone was able to agree. While there are other needs in our communities, and we mean no disrespect to any of the other priorities like food insecurity, the list is long sometimes, but if we had to pick the two biggest priorities, housing and mental health seem to be something that everybody agreed intersected with their work and would be the priorities to discuss. So what's nice is the CAN has provided training for all of the nonprofits. They've brought in training, and gosh, over 100 people attended the training about, how to talk to your legislators and what should a legislative visit look like. And they've also helped draft the language around all of this. So they've drafted the advocacy priorities. And so now any member of the Bucksmont Collaborative that wanted to is going to Harrisburg May 7th, next Tuesday. And I think close to 60 people registered now. I'd have to check with them to be sure. But I've had the pleasure of leading the subcommittee of the CAN around mental health, but learning a lot from my friends at Children's First and other advocacy agencies that do a lot more of this work. And so we have our script, we have our talking points, and I think we have over 15 visits scheduled that day with local legislators. And there's groups of 4 to 6 of us going to each one of the legislative offices to talk about the housing priorities and the mental health priorities. Yeah.
So let me ask you a couple questions then, because that's what we do here. We ask the questions that normal people would ask you and want to be interested in. So what are the priorities for mental health in Bucks County? Because we've got a lot going on. Like we help you with your marketing. So I know a lot of what you are very dedicated to the mental health space. So
we do. Ultimately, and I hate that it is about this because, money doesn't solve all problems, but we need more money in mental health. And so we are asking for increased base funding to the counties so that we can adequately and sustainably support behavioral health. So there actually has not been an increase in many years. In fact, it was stable funding. So with the costs of inflation and things of that sort, it actually leads to a decrease in funding. And so we really are asking for a significant increase in base funding to the counties. Which includes some funding around 988. right?
Oh, yeah.
Because we've launched 988 at a federal level, at a state level, we have not supported that financially. And so we need some funds to be able to adequately support 988. The second piece is really improving the workforce. So, we can advocate for more beds, or we can have, the county's getting ready to break ground on their crisis stabilization unit. And all those things are great work, but if we don't have the staff to put in these facilities,
Right.
it becomes a bigger challenge, right? So really addressing workforce shortages, trying to remove some of the barriers around peer support. We have found that peer support works really well, but there's some legislative barriers around utilizing that. Also including the certified recovery specialists, that's similar to peer support. And so there's barriers to using them. Some remote workforce items. So looking at workforce is the second piece of that we really need to be putting a good lens on. And then the other piece that is so important is mental health parity, right? I think we really need to look at reimbursement rates. And so, we know that reimbursement rates for physical health sometimes can be challenging depending on what the health systems have been negotiated into, but they're even worse for mental health. And so, if I'm a practicing psychiatrist, there is no reason in the world for me to really want to take insurance anymore because the reimbursement rate is so low. And so what that does is that means that only people who have enough money to play privately can afford that care. And then we're right back to really inequitable care in our community for people with mental health needs. So really looking at some of those things are our priorities.
Right. Yeah. I mean, in the mental health space, we've come on here and I have personally shared that I am a huge proponent of mental health. Reach out when you need it. And it doesn't cost that much depending on where you go. However, if you want to get into the space of a private therapist, first of all, it's really hard to get one even to answer your calls anymore because they are inundated. Right. But they can be up to $175 an hour in the greater Bucks County area. There isn't an insurance company on the planet that is going to probably reimburse more than probably $65 maybe. So that is, and if you then knock down to the kids level of needing a therapist, someone who's going to work after school or on the weekends, the availability shrinks and the cost skyrockets. That's pretty much what happens these days. And so I think it's really, well timed to say, okay, what's actually going on here on both sides of the issue, right? And so that is phenomenal that you're doing that. And I do want to point out that for right now, if someone is suffering, and it's usually not the person suffering that needs the information, usually it's their loved ones, friends, and colleagues who are like, hey, why don't you reach out to 988? Or as we've talked about with BCHIP, the hub at the county level. They have a variety of services, and the there's mental health services pages. Now, again, it takes some elbow grease to get, and that's part of the problem.
Yes, it is, because it's hard to navigate. It's not the easiest, but you're right. The hub is a great place, or PA Navigate, which is the Pennsylvania version of Find Help, right? That we've been involved in.
Yep.
But to your point, it takes time. It takes patience. It takes persistence. And so all of that can be really challenging when someone is trying to seek the help that they need for themselves or for somebody else.
Yeah, and there's lots of great services. So there's Nova for victims of assault. So that's great. There's A Woman's Place, which is near and dear to my heart. If you've been, a victim of domestic violence, trauma, abuse, any sort of abuse, call there. But again, there's always a process, which is why services like 988 are phenomenal, like the domestic violence hotline. You can call and get someone on the phone. Phenomenal, right? What I would be cautious about, and what will be really interesting to hear your opinion on, are mental health services that are AI.
Oh, wow. Yeah, I don't have an opinion on that.
Right. I'm sorry. I should have said eventually down the road.
Yeah.
Because that is where a lot of funding is going, because everyone thinks it's cheap and it's, well, I should say it's cheap, meaning like low cost, right? You're just talking to a bot, which I can't even get my water heater inspected through the bot. I don't know how any bot can serve a mental health crisis right now.
Yeah.
But they are looking at even video conferencing with an AI bot, which is nuts to me. But
Yeah.
again, low cost. So I think we're going to watch some dollars go there, but how is that going to play out in, actually helping people?
Yeah, that's really ultimately what it comes down to, right? We don't need someone just to answer the phone. We need someone who can demonstrate empathy and understanding and compassion and have all of those kind of skills, that skill set that's needed to somebody in such a vulnerable moment. So we'll see. We'll see. I can't imagine. I mean, I hope I'm wrong. Maybe AI would be a solution, but I can't see how we could have that interconnectiveness that's needed in moments like that.
Right. And you're so wise to be advocating for a better workforce, right? Because that is so needed. Because also it's expensive to go through graduate school. And then I'm not really sure about the rules in Pennsylvania, but I remember from long ago, your average psychologist had to put in like 100 hours of practicum time. Is that what am I saying all that right? And
Yep.
for free.
Yep.
So now we're not even paying you to be trained as a mental health advocate. So now you're broke and waiting tables. It's like, wait a minute, like,
let's hope it doesn't go that way, but yeah.
But that's what happens. You're putting in those 100 hours of practicum time, and it's just, and then people want to leave those programs and obviously make money, which is understandable.
Yeah, which, God forbid, it's really, doesn't make them a bad person to want to make money, right? We just need to find a way that, those that deserve to be making the money are still meeting the needs of the community, that they can do it in an affordable way.
Right. And that's what BCHIP is so great at. What are the needs, all of the healthcare needs of the community of Bucks County? And then if once they're identified, you are really good at seeing like the intersecting partners and points, right? Because you can see it from that 20,000-foot view. So I'm glad that you're taking a field trip out to Harrisburg. You'll have the next video, we can hear
Talk
how
about
it
it.
went. And I do have to say, I'm sure you have notes. You did an excellent job. So you're well prepared for all of your visits.
I intend to be. I have a whole week.
We would expect nothing less.
It's interesting though. It's going to be one of the busiest days at the Capitol. I've done some advocacy work before, but it's also Pennsylvania Cancer Action Day that day. So the American Cancer Society is there advocating for their needs around cancer. Also, the American Lung Association is there to advocate for the Clean Air Act, as well as the tobacco settlement funding continuation. I've also learned that Ceasefire PA is there discussing gun safety. So it's funny because our work at BCHIP intersects with a lot of that. So our team is kind of bouncing all around to try to engage in some of those meetings and support some of our other partners. Even though my primary commitment is to the Bucksmont CAN and the mental health work, if we can, we're going to visit some others. So stay tuned. We do have a press event that I get to speak at there next week. So maybe we'll be able to link that to some of the work we do too.
Yes. Take a video. What do we always say here? Take a video. Let's get it up so that, and Kim if you've ever heard Kim speak, you are a great speaker. So
thank you.
So that's it.
That's all we got today.
Excited about, you never know what we're going to come on here and talk about. So thank you. And good luck with your trip to Harrisburg, and we can't wait to hear more.
I appreciate it. Have a great day. Thank you.
Bye.